Dr. Soni.
Hi doc.
Today I have 10 questions for you. Is painless dental treatment really possible for children?
Absolutely. So we proudly present ourselves at Vanilla Smiles as a painless and a tearless happy gas center. So with various spectrums of sedations at our disposal, it's actually a reality now. And a lot of parents actually fear that whether their child be able to cope up on the chair or not. So you should actually see the transformations to believe.
What is laughing gas sedation for kids? Is it safe?
Yes, so this is a form of an inhalation sedation where a mixture of your nitrous oxide and oxygen is given to children. It takes them to a certain level of relaxation and trance where they're not bothered about what's happening inside the mouth. So they're relaxed watching the TV, they're in their happy zone and allowing us to work. Secondly, we are able to finish quadrants chair side. So when I mean quadrants, that means a lot of work. So say 2 or 3 teeth on one side, finishing in a single dose of local anesthesia is actually a reality now.
How do you manage dental anxiety in children?
So at Vanilla Smiles, we offer all the forms of sedation. So from inhalation sedation to oral sedation with midazolam to intravenous sedation with a standby anesthetist. And last but not the least is basically your general anesthesia, which happens in a hospital setup. So depending on the level of anxiety and fear, we upscale the child. So we never start with general anesthesia as the only option for your child. We always begin with laughing gas. If that does not work, then we mix. We do a combination technique of oral sedation plus the laughing gas. If that also does not work and the quantum of work is less, then we would prefer doing it under IV sedation for ASA1 children. And in case of children who are syndromic, the quantum of work is a lot. Say we are treating 16 out of 20 teeth, or for that matter 20 out of 20 teeth. Then in those cases, we prefer that you put the child to sleep in a hospital setup under general anesthesia and finish the treatment at one go.
When should I take my child for the first dental visit?
So good question. So basically, your first dental visit for your child should happen at the age of 1 or whenever the first tooth erupts for your child. But you can always establish a dental home much before the child comes to this world. So while the child is in your womb, your preventive care can actually start at that front. So we recommend working in close association with gynecologists who tend to send these expecting moms to us, and we can actually guide them into their oral hygiene, which eventually will get passed on to their little one.
Why is CO2 laser better for pediatric cases?
So as we discussed, right, so we are seeing children as early as with the first tooth erupting or the first year of their life. But there are certain children who have failure to thrive because they are not able to breastfeed properly. So these children tend to knock at our offices as early as a week old or 2 weeks old. And that happens because of tethered oral tissues, that is TOTS. So sometimes these children come up with tongue ties and they're not able to exclusively breastfeed. And that's where the role of your CO2 laser comes in. So CO2 laser is precise, it is quick. So we are able to release these children's ties in almost like 15 to 20 seconds with maybe without any need of any local anesthesia. And thirdly, CO2 laser is basically a true cold laser. So the chromophore or the molecule that the CO2 gets attracted to is your water. So you can actually release the ties to a depth of 0.1 to 0.2 millimeters. So that helps us release precisely through the mucosa, through the fascia, not causing any collateral damage or heat built up in the adjacent tissues, because it being a true cold.
Are digital x-rays safe for children?
Yes, gone are those days when you're actually taking x-rays on films, developing them, wasting a lot of time and exposing your child to a lot of radiation. So now with the advent of digital x-rays, your RVGs, your exposure to x-rays is so minuscule that it's even less to what we are being exposed to, the extraterrestrial radiation. So it's absolutely safe taking a full mouth x-ray for your child.
When does a child need dental treatment under general anesthesia?
So children who are not able to cope up on the chair, as we discussed, so the child, we have tried laughing gas, we've tried oral sedation, all forms of sedation has failed for your child. You don't want to hold and pin and scar the child psychologically for life. Second is children who are pre-cooperative, that is less than 3 years old, and the quantum of work is more, that is more than 10 teeth involved, and where minimally invasive pediatric dentistry is not possible, it needs multiple root canals and crowns. And last but not the least are children who have very little attention span, that is your children with autism, your attention deficit hyperactivity disorder, children struggling with that, and syndromic children who need extra care at the hospital front, and a care in a manner that a definitive care needs to be given to these children so that these children don't have to sit for their dental work again and again on the chair. So these are the children who we would want to treat under general anesthesia.
What is airway focused dentistry?
So we are working in close association with the ENTs now. The ENTs also understand that just removing the tonsils is, or your adenoids is not enough anymore to just clear, to make a clear airway for these children. So children who are actually suffering from sleep disordered breathing can be suffering because of constricted jaws, because of irregular oral tissues, which needs an examination from a pediatric dentist at that front. So we work in close association with the ENTs for the same.
Can Invisalign be used for jaw expansion in children?
Yes, so Invisalign has come up with their expanders, which are removable, which adapt very well to the jaws. They are not bulky appliances, and we've had very good results in some children who showed signs of snoring initially, who showed signs of disturbed sleep, who showed signs of open mouth posture. So along with orofacial myotherapy, we've had very good results for these children using the Invisalign technique.
Why are follow-ups important in pediatric dentistry?
So very good question, because a lot of times these parents come to us when the child only has pain or has developed abscess. So once a full mouth rehabilitation is done for the child, we follow a meticulous follow-up system depending on the risk assessment of the child. So if the child is high risk, we would want to see the child every 3 months for that year. If the child is medium risk, we usually see the child thrice a year, that's every 4 months. And once we know that after 2 years of preventive care with us after a full mouth rehabilitation, that's when we put the child under low risk and we are able to see these children twice a year.
Thank you, doctor.
Thank you.